This is an Eye on Annapolis bonus podcast.
We're joined on the phone today by Michele Eberle. Once again, I feel like I need to send you like a jacket or something for like a frequent guest. But Michele is the executive director of the Maryland Health Benefit Exchange. And we're going to be referencing it a little bit through this conversation, but you want to write this website down, marylandhealthconnection.gov. Important website if you do not have health insurance through your employer. How have you been?
I've been very good, John. Thank you for giving me the time today to spread our message.
Well, I'll tell you, along with Thanksgiving and Christmas and New Year's and deer season, it is open enrollment season for health coverage here.
It is, and it started November 1st, and it will go through January 15th. However, for folks that want to have coverage effective January 1st, they need to apply by December 31st.
Okay, otherwise it jumps in on February 1st.
That's correct.
Okay. Now, to recap, this is the Maryland answer to the Affordable Care Act, or more commonly known as Obamacare, which is, 3 presidents ago, it seems?
Yes.
But it is a health insurance marketplace, which is available to those who aren't getting it on their own or through employment, right?
That's correct. And there's actually some new benefits that we haven't had before, and there's some changes in federal laws. So for folks that maybe the one parent or one spouse works for a company and gets health insurance through that company, but they don't offer affordable coverage for the family. In years ago, that family could not go through the exchange and get tax credits. But that law has since changed, or that rule has since changed, and now they can. So we like to say, even if, part of your family is covered through an employer plan, but the rest might not be affordable for you, come to the exchange and see you may qualify for tax credits.
Oh, that's something interesting. So if you're, say, a married couple or married with family, and then you have the company provides for the employee, period, and then you have to put out of pocket for the other one, then
correct.
You should go to the Maryland Health Exchange and see if the out of pocket with the employer is, whether you can do better at the health exchange.
That's correct. And that used to be you weren't able to get those tax credits, but that federal law changed, so now you are able to. So we always say, when in doubt, if you don't know if you're able to get health insurance on your own, just come to Maryland Health Connection. We can help you figure that out.
And check it out there. Well, again, it's perfect for the or underemployed sole owner companies like me, gig workers, or anybody really that kind of falls in the cracks, because there are a number of them that are unable to access insurance. And from what I'm gathering, this is something that the vast majority of people that don't have insurance, this gives them access to it. I mean, it may not be necessarily affordable to absolutely everybody, but there is the ability to get everybody insured through this program.
That's correct. We can insure most Marylanders. The one segment of Marylanders that we don't or can't insure right now are those that are not here with legal documentation. But again, we tell families, if you have one person in your family that does not have legal documentation to be a U.S. citizen, but others in your household are, you will likely qualify for health coverage. So again, don't let that be a barrier for you.
Make the call or go to one of the assistants at marylandhealthconnection.gov.
That's right. And we also have over 1,000 producers statewide. These are licensed, authorized insurance agents, free of charge, that can help you. We've got our local health departments that will be happy to help you. We've got our navigators. Go online, as you said, marylandhealthconnection.gov, or download our mobile app, Enroll MHC, and you can get all sorts of assistance right in the palm of your hand. So we've got lots of ways to help you this year.
Fantastic. And just for, again, those that aren't familiar, this is not necessarily free insurance, although it can be free, depending on what your situation is. I mean, this is a subsidized, if you will, by tax credits, right?
That's correct. And we also have, in Maryland, we implemented something called a reinsurance program. And that is has allowed us to actually have the lowest rates in the nation on what we refer to as our bronze and our gold plans. So that's really good. I mean, it may feel that it's still expensive, but it is very affordable compared to the rest of the nation. The other thing that we have is a special assistance, state assistance for folks that are under the age of 37. And we actually increased that age this year from 34 to 37. So again, it may only be $40 a month, but that $40 a month may be what you need to get you over that hump of being able to afford that health insurance. So as you said, we have plans that, are $0 plans depending on your income. In fact, I'll just give you an example here. Consider a person who's 25, lives in Baltimore City, has an income of $27,500. They would pay $0 for a gold health plan, which is a very rich benefit health plan. And that's because they would be able to receive federal tax credits and state subsidy, which would take care of that premium for them. So very, very affordable.
That's fantastic. And I'll tell you, even, at $40 a month or whatever the premium is, it's a heck of a lot cheaper than if you have some kind of a catastrophic illness or accident. How many Marylanders have gone through this program now? I mean, I know.
Well, we had last year, of course, we're in an interesting year because you may have heard about the Medicaid public health emergency where people were continued on Medicaid, which is fully funded insurance based on income. For a while. So they were maintained on that through the public health emergency from COVID. This year, we're now transitioning those folks into other forms of health insurance. So those that have purchased through the exchange, we had over 190,000 on the exchange. And now we're moving into open enrollment. And so we're hoping for 2024 to even, well exceed that. So we've got coverage for as many people as we can get covered. We want to have them come through the exchange.
Now, question. Now, I am I don't know whether you call me a customer, a client, or a user.
Consumer. We refer to you as our consumer.
Okay. Well, I am consumer number 1893, whatever it may be. But do I need to re-enroll this year if I've had it last year, or will it just roll over?
Excellent question. You would have gotten a renewal notice in either online or in mail, whichever way you chose, in early October. If you look at that, you like your health plan, you're okay with everything as it is, you don't need to do anything except pay your January premium. So we'll just continue in that plan. However, we do always encourage people to come in and look and see if there's a plan you would like better. We have a new insurance carrier this year, Aetna Insurance. They are statewide, so that adds to Care First, United Healthcare, Kaiser, and now Aetna. This year, we've also added vision plans. So if you need a vision plan, you can purchase that through Maryland Health Connection. And we actually have revamped what we refer to as our value plans. And those are plans where we really look at and make sure that we're getting as many services to the consumer, what we call first dollar, before you have to pay for them. So those are some changes. So we always say, come and take a look. We've got tools online, or any of our in-person assisters can help you to really look at, what are your medical needs? Are you a low utilizer? Are you a high utilizer? And make sure your doctor's in the network. So we can help really pinpoint what plan would be right for you and your family.
Okay, I'm going to have to put my thinking cap on here because I didn't get anything in the mail, but I got my email that said I had a message in my account on there. But I can't log on.
Well,
I log on, it bounces me out, says, "Oh, you need to change your password." And I changed the password, and it says we can't do that right now. So
okay,
I've kind of ignored that, so I'm just going to have to dig in and figure that out.
Yes, and we actually have a new feature this year, which is a new passwordless entry. So that's some new technology. Again, you brought up one of the big barriers of renewing coverage, that you only go in once a year. It's like, what is my password? So now we're using some of the new technology to verify who you are in alternate ways so that you don't have to remember that password. So anyhow, we can help you, and happy to get someone to assist.
Fantastic. Dental coverage, I think it's Delta Dental is who I've got it through. That is the one through the Health Connection, right?
Yeah. But we have multiple dental carriers through there. Dominion, Delta Dental, and I'm missing some, but I think we have 4.
Oh, I may take a look at that and see that, because my dentist gave me bad news last year, so I gotta.
Uh-oh.
We maxed it out, and he says, "Hey, you want to do the?" I said, "Not until January, buddy."
That's right. Wait again.
But the big deadlines that we do need to know, though, are December 15th, and that would be for coverage that would begin January 1.
Correct.
And then December 31st. No, January 15th.
15th for February 1st.
For February 1st coverage there.
Right. And the other thing, John, if I might just add, I really want people to realize that health coverage now is not just to protect you from catastrophic financial implications, which it does very well. But since we have the Affordable Care Act, there's an awful lot of preventative health services that are free. I mean, pay your premium, but you don't have to pay additional for them, such as doctor's visits, mammograms, colonoscopies, immunizations for children. So a lot of that preventive care, your flu shots, is already covered, and we want people to utilize their health care to help them stay healthy and not get sick.
Well, that makes sense, because if preventative, I guess, is by definition, but I mean, if you are keeping up on your flu shot and you are keeping up with your, vaccinations, and you're getting checked, you're not running in with hey, doc, I've had this growth in the side of my face that's gotten bigger for the last 6 months. They can figure this out as soon as it starts to happen. Save yourself that big, huge bill if it should come down to that.
Right.
What happens if I'm covered under an employer, and I get canned, and they say, okay, well, here, you've got your COBRA, and I find the COBRA's too expensive, or I just don't want to do it, or whatever. I can enroll through the MarylandHealthConnection.gov as well, right?
You sure can. That's what we refer to as a special life event. So if you lose your job, if you get married, if you have a child, there's a lot of different situations that you'll see you need health care coverage. And so in that instance, you're able to enroll anytime during the year. So again, we always say, if in doubt, talk to us, come see us, because we will help you.
Okay, so good. So I don't need to wait till next November in case that
that
rolls around as well. And again, this is not for the over 65 crowd. That's Medicare, right?
That is correct.
And that's a nightmare of its own.
That's a different, unfortunately, that's a different can of worms. But we have a very good Department of Aging in the state of Maryland that can help you with that.
Medicare's sort of cousin once removed is the Medicaid, which is the public health, right? And that's
through Maryland Health Connection.
Okay, and that applies to pretty much everybody on the Medicaid, correct? Under 65, I guess.
Yes, that most people, and it's income based. So most people, if you qualify for Medicaid based on your income, most people would come through the exchange. Certain situations don't, such as nursing home care, but for most people, you'd come through Maryland Health Connection.
And for Medicare, or actually for Medicaid, there is no enrollment period, or is there?
No, that's year-round.
Okay, so anytime that you feel you qualify or need that, you can jump into that as well.
That's right.
I mean, what I think is sort of amazing that Maryland has made some big strides, not so much with your department per se, but to get connectivity to everybody in the state. I mean, we can buy Wi-Fi hotspots, or not buy, but take them out at the local libraries and everything else. So, we've made getting online very easy for somebody. And certainly this is a good reason to get online to make sure that you remain healthy throughout the year. And
that's right.
Whether it be through the app, through the phone. And what was the app again?
The app is Enroll MHC, and it's Apple and Android, so either way. And then the call center, 855-642-8572. We have bilingual Spanish-speaking staff that are always present. And then we also have access to a language line with over 200 different languages. So don't let limited English be a barrier. Again, we can help get you to someone that can speak the language you speak.
You know, it's so funny you mentioned about the language that you speak, and I work with the local high school here in Annapolis, and a lot of the people were telling me that some of the non-English speaking parents, primarily a Latino or a Hispanic crowd, there's such a small percentage of the parents that actually come into school, and a lot of that is because they're afraid that they're not going to be able to understand or communicate. And every time I get the chance, I got to say, no, they've got people that will speak your language. If they don't, they will find somebody. There's a way to do it because the schools, just like the Health Connection, want to make sure that, you're succeeding.
You're right.
And that's fabulous that, you've got all the different language translators and stuff like that. And if I spoke anything other than Latin, I'd give it a shot, I think.
Yes, that's our mission is to make sure that we are in communities where people live and that we have folks that know the communities that can help get folks enrolled. So we know health insurance is very complicated. Even I've been in the industry for most of my life in my career, and it still is confusing when you look at how much on that copay. In fact, I had a bill this week that I had to call on because the billing vendor coded it wrong, and it wasn't covered because it was coded wrong. So those are things that if you don't have any understanding of health insurance, it's very complicated. So we try and make it easy.
And I certainly appreciate that. You hear the nightmares all the time about the miscodes, and I know, there's lawyers that actually, specialize in going over hospital bills. Say, this is wonderful that it's just so easy to do it. Again, MarylandHealthConnection.gov is where you want to go to start. And again, what did you call them? Navigators. That's the word.
Navigators.
And those are real people that you can talk to or chat to that will guide you through the steps.
Absolutely. We just have, again, lots of people available to help. And if I like to say on the mobile app because it's easy, but you can also do it online. If you have a mobile app, you can just click the button. It says Get Help, and you click on the button to get help, and it will show you all the places located close to you where you can get assistance.
Fantastic. Is the help available 24/7?
It is not available 24/7. No, we do have extended call hours, but we also have something new that we put in place, and it's called Broker Connect. And you can say, I want a broker. Again, these are the licensed professionals to reach out to you within 30 minutes. And we have a whole methodology of getting information out to our brokers, and then we expect that one would respond and get back to you within 30 minutes. So it's a really great way to get an expert on the line to help you.
You guys are making it really easy for everybody. And again,
good.
I think, the health insurance, there's a plan available for absolutely everyone. Myself, I am a solo practitioner business, from the CEO all the way down to the janitor. I've got all the positions. And it does make it affordable. I will say that the first year that the Obamacare passed, it was like, oh, somebody in Washington missed that whole affordable part of that. And it was crazy. But I will say that my premiums have actually gone down. I haven't seen this year's yet, but over the last couple of years through COVID and stuff like that, they actually went down, which was really kind of a refreshing thing to see.
Good. Well, we really work hard to try and keep our rates low. So,
well, I do appreciate all the work that you and your team are doing you guys are up in Baltimore, right?
Yes, our office is in Baltimore.
Again, everyone want to go check out MarylandHealthConnection.gov if your health insurance is not quite where you think it should be, whether you don't have it, whether you think you may be able to save a couple bucks, because right now, certainly we all can use any opportunity to save a few bucks. It may be a better opportunity for you and your family to do that, to get off of an employer-sponsored plan or not. But as Michele said, it makes all the sense in the world just to give a call and check. I don't think anybody's going to get mad at you for checking.
Not a bit. We'll help you out if we can.
Fantastic. Michele, thank you so much for your time. Thanks for always keeping us up to speed on what's happening with the marketplace here in Maryland. And once again, Michele Eberle is the executive director for the Maryland Health Benefit Exchange. And you guys are the ones that are running the whole thing. And the website, marylandhealthconnection.gov, is where you want to go. I do recommend everybody go there. Just check it out. And right now, I'm going to go figure out how the hell to get past my password problem and see what kind of message they have for me.
All right, John, thank you so much again for giving us the opportunity. And hey, if you can't get through that password, call me and I'll have one of my team help you.
You probably got them all on a sticky note on the side of your computer, don't you?
No.
Yeah, I know how the state government works. Michele, thank you so much, and have a wonderful holiday. And I guess, come January 15th, have a margarita on me somewhere.
All right. Thanks so much.
All right. Take care.
Bye now.
Bye-bye.
This has been a bonus podcast from Ion Annapolis. Please visit us at ionannapolis.net. Follow us on Facebook at All Annapolis and on Twitter at Ion Annapolis. And if you haven't subscribed to the Daily News Brief podcast, go for it. And all of your local news will be delivered to your phone, tablet, or smart device by 6 a.m. every Monday through Friday.